Welcome to my podcast. I'm going to talk about another important case. Basically, after you introduce yourself and double check the patient's name and date of birth, so I'll ask the patient, how can I help you today? So the patient might have issue with drinking. So the patient would like to know more information about alcohol, side effect, or alcohol health-related problems. And they are thinking how they can cut down that or maybe reduce it. So basically, you will tell why would you like to know that? Is there a particular reason? Then you will raise the patient awareness by handing a leaflet or a booklet or anything related to alcohol, and then explain to the patient and ask them if they need more or further information. So I'll start off with head and neck, basically. So you say it has a relation with head and neck cancer, mouth cancer, esophagus cancer. It has research has shown that red wine can cause breast cancer in women, and it has strong association. It can lead to heart disease, stroke, and high blood pressure. It's the main cause for inflammation from the pancreas and the liver, because the liver is the main organ for the filtration, so it can lead later on to cirrhosis and fatty liver disease, and also liver cancer. It can affect the digestive system in different ways. It can weaken the immune system, and later on, with too much drinking, can affect the memory, which lead to poor performance and dementia. And when we talk about drinking, there's basically four types of drinking. There is the social drinker, who are drinking only in the social occasion. There is the drinker to conform, just to change their mood, change their for fun or whatever, and drinking for enhancement. And sometimes people drink to cope with certain situations they face in life. So basically, if there is too much drinking, which means like binge drinking, which is for a woman, it's more than four or more than four, or for men, five or more in one single drink, which is basically more than 14 units for the recommended drinking per week for both gender. This will lead, of course, to affect in mental state, so it will cause mental confusion. Patient will feel tired, sluggish, having a problem with sleep. They have issue with concentration and with conscience. They might start vomiting, trouble breathing. Their heartbeat might slow. Their temperature might slow as well. They might have seizure in extreme condition. They might have dull responses. They won't respond. They might have dull responses, which means there is no gag responses, which could lead to choking. And of course, this will have other consequences. And in severe condition, too much drinking, it might affect the brain with severe permanent changes and damages to the brain, and eventually death. Drinking a bottle of wine per day, this could lead to increased addiction risk, because this will have more than the recommended dose, which is basically equate to 9 units per day, which means 63 units per week, which is way far than the recommended 14 units per week. Also, alcohol can affect the skin in many ways. It can lead to aging by reducing the collagen and elastin production, which make the skin looks like dull, wrinkled, and aged. So that's basically, in short, about alcohol side effect and the health-related side effect. So you will just explain and raise the patient awareness about those problems, and take it from there. And if they want any further help, you can direct them to the channels which can help them to do so. Thank you.